let's consider the first part of taking a look at a case study, and more so what we do as teachers and special education professionals when this type of situation happens in schools. And it happens very, very frequently, especially in elementary schools. We're talking about Nicholas and his mom and his general education teacher, Mrs. White. What you need to think about is that incredible teacher skill of taking a look at all the things that have happened with Nicholas, his academic progress or lack thereof, some of his behavioral needs, and most of you are probably pretty familiar with something called a SST, a student success team, student study team. We used to call them child study, which has a little bit of a medical model. But when a teacher has concerns about a student, gen ed teacher or special ed teacher, the first thing that they would do is take a look at the data that they have. And that's kind of what has been presented in Nicholas's case study. You're going to find a couple of things. I'm not going to outline them exactly, but there are triggers from the Michigan Department of Education Child Find document that are described that Nicholas is starting to exhibit. Academic struggles, data and test scores are dropping, performance is dropping. We're not looking at anything with MTSS. You're not seeing any evidence here that is described as multi-tiered levels of support that can come in and help Nicholas out. For example, all of the things that Mrs. White has described are universal for everything in her class, everyone in her classroom. If we want to get technical about it, we're looking at tier 1 level information and data, but we're not seeing a whole lot of action or data for anything at tier 2 or tier 3. So look away from what we've talked about MTSS and dig in a little bit with some of the child find triggers. And there's a distinct time during the SST meeting and during the description that the general education teacher suspects a disability and requests evaluation and determination for special education services. Moves on to having a meeting with the parents. And that's when things get really dicey. Mom is alarmed immediately, even though the gen ed teacher thinks that she has permission and agreement. The gen ed teacher is really on a fast track to special education. I don't want to throw anybody under the bus, but she's kind of washing her hands of Nicholas and kind of thinks her job is done and he needs extra help. He needs outside help, which to her means special education services. Again, I want you to notice the complete lack of MTSS data, documentation, especially team-based decisions, the collaboration needed. If you think about the 4 pillars of MTSS from our chapter in our course text, it's just not there. So that's kind of the summary. I'm giving you a verbal summary of what I see. If you were to choose this as your assignment for one of the 3 out of 5, I would expect you to have a lot of detail in this part. Summary that directly answers the prompts to the analysis questions. But for right now, I've described to you the engagement piece, the summary of what's going on with Nicholas.